Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rinkus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Lindsay Seefeldt, a doctor of physical therapy who specializes in oncology rehab and lymphatic services. Lindsay is the owner of Uplifted Oncology Rehab in Green Bay, Wisconsin, and she brings a wealth of knowledge and expertise to her practice. She's a PORI-certified comprehensive oncology rehabilitation specialist, meaning she's specially trained to support cancer patients at any stage, whether they're newly diagnosed, going through treatment, or entering post-treatment survivorship. But that's not all. Lindsay is also a certified lymphedema therapist, helping those with lymphatic concerns and lymphedema find relief and regain their strength. We're so excited to have Lindsay on the podcast today to talk about how she's helping people heal and thrive after a cancer diagnosis, as well as what we can do now for cancer prevention. Let's dive in. Hello, everyone. Welcome to the podcast. We are excited to welcome Lindsay to our podcast today. Welcome.
Thank you.
And we are jacked about the 4 topics we're going to be talking through in your episodes. And today we're starting out with her specialty, which is oncology rehab. But if you've ever listened to our podcast in the past, you know that we love to get to know you a little bit first as a guest. And you shared with us that you are a mother of 4 and you have a set of twins. I'd love to hear a little bit about your journey with twins and 4 kiddos. And
it's crazy. My husband and I'll start with, we had 2 older boys. Okay. My husband, I love this story. He told me, okay, we're done. We're not having any more children. I'm happy with 2. And I'm like, I just want to try for the girl.
Oh boy.
And, I said, if we end up having a 3rd and it's a boy, I will be done. I promise. And I got pregnant, with twins.
Are they boy, girls?
They're girls. So I thought for sure God was going to give me 4 boys because I wanted girls, but yep, I have 2 boys and 2 girls. So.
And what were the ages of your older 2 when your twins were born?
So my oldest was 6, and then my next little guy was 3, and then, so pretty much 3 years apart.
Okay.
What was the most challenging piece? Because that sounds exhausting.
I think it's just balancing and juggling with twins. I mean, I'm thankful that they were, my 3rd and 4th versus 1 and 2, because I knew how to, do everything. It's just double of everything. And my husband is so supportive that, we could pass the kid off, and my mother-in-law and my mom were retired. So I had a team that really helped raise these kids when they were little.
How old are they now?
My oldest is 13 and then 10, and then the twins are 7 now.
Okay. Fun. Those are fun ages.
Fun. Still challenging.
Still challenging. Every age brings a different challenge.
Yeah, for sure.
For sure. But yes. So we would also love to hear your story, because you're a physical therapist, but you specialize in oncology rehab, which is something that many people may not even know exists. So why don't you tell us how you first became interested in becoming a physical therapist, and then what led you to oncology?
Yeah. So I started, in the medical profession in an outpatient facility. And at the time in our department, it was just by fate that, I kind of chose this path. We needed a lymphedema therapist. And I'm like, yeah, I'll learn how to do lymphatics. And as soon as I did that, I fell in love with working with my hands. So I worked with lymphatics for years, but I started noticing a general pattern. The people that were coming to see me had a cancer journey. And, I kept thinking to myself, why are these patients coming in so late when they're already having the symptoms? We're talking individuals that are having massive amount of swelling, like severe pain. And, this is the first time that they had ever sought out any type of professional for this. And it really got me thinking, there's got to be a better way for these patients. And I did a lot of research because just by law, we have to obtain for our licensure, we have to have so many credits per year. And so I'm like, I bet there is a program out there that trains therapists how to become a better practitioner on oncology. And so I did seek this out, and I just went full force. It took me 4 years to complete, but I became a certified oncology provider. And I just saw the immense change with my patients. And I was a mission to get this out there so that more people are aware of oncology rehab, because it changes lives.
Mm-hmm. I feel like it's definitely not something that you hear about at all in hospitals.
No,
at all.
No, I think this is very, very new. Like, I guarantee if you took a poll of most people and even listeners right now, I bet they would say they have never heard of oncology rehab, but it does exist.
Now, you mentioned lymphatics and then oncology. So some people who maybe do not work in the medical field, let's just cover those. You kind of already mentioned oncology is cancer patients. Yes. What is the lymphatic system, and what does it have to do with cancer?
Yeah, they're very married. You cannot go through cancer without having some kind of disruption of your lymphatic system. So your lymphatic system is what, maintains water balance. It's where we fight diseases and where we fight cancers. And so a lot of times cancer will develop in the lymphatic system.
So how is this different than your immune system?
Their lymphatic system is your immune system. It is. It's married. Yeah. It's the same exact thing. Okay. So this is where we fight our immunity. Yes.
Awesome. Well, and thank you for clarifying that, because I feel like that's just one step in being like, what are they even talking about here? But then oncology rehab, what does that look like? Like, how does it differ from general physical or occupational therapy?
Yeah, good question. So oncology rehab basically is rehabilitation meant specifically for the cancer patient. And you think about this, I love giving this example because it helps put it in perspective. But if you think about your children, your kid comes to you has ear infection, right? What do? You take them to your regular pediatrician or urgent care or something like that. That basic provider can treat that. But what happens when your son breaks a bone? You take them to an orthopedic, right? What happens, if you have neurological type issues, you see a neurologist. So in the medical field, you have specialists, right? In the rehab world, you have specialists as well. So when we're talking rehab, we're talking, physical therapy, occupational therapy, and speech language pathologist. And so oncology rehab is just a little niche. There is special training and so much knowledge is put into this. Like, when you think of a patient going through cancer, it's not only their cancer that they're dealing with, but all of the different treatments that a lot of these individuals have to go through. And it is so important that you have that knowledge, because you've got to know how patients respond to radiation. You have to know how they respond to different chemo drugs, because you can do irreversible damage if you're pushing a patient too hard and don't know how to rehab them.
So, and that's why it's important to be working with a specialized therapist.
Yes.
Right. And you mentioned certifications, and I know one of the ones that you hold is the PORI certification. Is that how you say it?
Yep.
Okay. Correct. And tell us a little bit about what that is.
Yep. So PORI stands for Physiological Oncology Rehab Institute. And so this certification course, the founder is a physical therapist, and she developed this program, and it's based out in Denver, Colorado. And so I actually went out to Denver, Colorado to be trained by her. And so she has an in-depth and research-based program that she trains her therapists on. And it's all about, understanding all the different levels that your body goes through with this cancer journey. So, I received in-depth training on, like the different levels of cancer and what it can do in your body. And then, we really dived in deeper into like, okay, this is how you rehab someone going through radiation. This is how you rehab someone going through chemotherapy. And we even touch upon, post, survivorship, where, women decide to have some kind of reconstructive surgeries. So I know how to rehabilitate different levels, whether they have implants or whether they have different procedures to make different breast tissue.
That seems really in-depth.
Yeah, it does.
Yeah, it was very in-depth training.
In 4 years too.
Yeah, it took me, so there was different levels that I took. So I am certified in breast cancer. I'm certified in pelvic and GI cancers. So this is all your, gynecological, prostate, rectal, colorectal or cancers, and then head and neck cancers. So each of those levels are very in depth. I mean, we're talking like I'm getting week training on all of this. And, it's not only the classwork, but I mean, I had to demonstrate, how to perform these techniques to be passed. So, and then I had to sit for an exam as well.
Wow,
so
that's amazing.
Yeah, it was very intense, but I'm a better practitioner for going through this.
For sure. And I feel like someone can walk through your doors with confidence, that you can really help them. But when someone does walk through your doors, somebody's coming in with the idea of what rehab looks like traditionally, right? So if I had a surgery on my rotator cuff, I'm going to come in for therapy. It's going to include some mobility, some strengthening, some functional movement to help me function in everyday life. With my shoulder, cancer is internal. So what do your appointments actually look like?
Yeah. So, I mean, it depends on what level or like when they come in and see me, and we'll talk about that in a little bit. But, typically it's, looking at the patient, I spend a lot of time with my patients understanding, what's important to them. What do we need to get them back to? But, when we're talking, I'll give an example of breast cancer just because it's so prevalent out there. If a woman has a mastectomy, for example, we're not only talking about the scar tissue on the top. I mean, that breast tissue is removed, but, a lot of times they're doing, dissection of lymph nodes to test. And so we're taking those out. We're all the different components near your chest, your ribs, your shoulder, your scapula, even the head and the neck. So it's looking at the whole picture and, depth by depth, understanding which way we need to go in order to rehab, and then teaching my patients, how to do different things at home so that they can advance and, safely advance.
When should people come and see you? So if they get a diagnosis, what's ideal? And then when do you typically see people coming in to see you? Like what's average?
Yes, these are both opposite. So ideally, time of diagnosis, that is so important. And I really push my patients, like at the time of diagnosis, it's so important to establish with myself because you can get a really good baseline. This is where I take a lot of measurements. So we're looking at, I do a lot of girth measurements. So I'm taking measurements of the arms, the legs, the abdomen, the trunk to monitor any type of swelling. I do like cardio, like I look to see what your endurance is like. I look at your strength. I look at your balance. So that first appointment is all about understanding where you are today so that down the road we have data to go back to really see like, wow, you did change. Look at where you were, look at where you are today. Unfortunately, a lot of patients aren't coming into any type of therapy until after everything is done. So we're talking like, they're in survivorship and they have never seen anybody through this whole course. And I mean, this is horrible on your body. These patients are going through so much, and a lot of them are coming post everything. So they're already developing swelling in their extremity. They're already having severe pain. They're already having severe loss of function. They have no energy or strength. And so a lot of times when they're coming to see me, it's when those like bad things are already settled into their body.
They're already in desperation mode.
Correct.
Yeah.
Yes.
So then how do you help someone starting at that point?
At that point, well, it takes a little bit of work, but we can help rehabilitate them at that point. But a lot of times, if we're getting, I'm seeing them a year or 2 years post their cancer, a lot of the stuff is already settled in. So we're talking like scar tissue is already well formed. We're talking the lymphatic system is already well congested. I mean, we can improve it, but sometimes I can't reverse it. So at that point, it's trying to get them to a better functional state, but it's not getting to them the perfect state.
So in a typical cancer journey, like, you have the doctors telling, you go through the treatments and everything else. When it's post, they're like, congratulations, you're done with your cancer. Typically in the hospital, do they give any post rehab? Like, is there like anything that's really helpful for patients once they actually are done with their cancer?
Well, I mean, a lot of times I think doctors won't necessarily jump into anything unless the patient is complaining. So, I think, I don't think patients realize that there's things that can be done. Like you had mentioned, like, it's like, congratulations, you're alive. And it's like, well, now what?
Right.
Like I know it's great, but I'm dealing with all these aftermath type things.
Your weekend, your nutrition is not there. Everything is really just out of whack. So it's just kind of like, how do you get your life back?
Yeah. And I just I think there's such a lack of education and guidance that there are providers out there that can help you through this journey, and you don't have to live like this.
Yeah. Do you find that most patients are referred to oncology rehab, or do they generally just have to seek it all out on their own?
I think at least a lot of the patients I see, they seek it out on their own. And you don't know how many times I've had, patients that have come to me and like, why didn't they tell me about you sooner? Like, you mean I could have been in like way earlier and I wouldn't have had to deal with X, Y, or Z. So I will tell you, like, probably 9 times out of 10, patients are coming to me and they didn't even know that I existed.
I feel like I'm a little bit shocked that this isn't just standard for a cancer patient. I mean, so much is happening in your body and outside of your body. If there's surgeries and things like that, like, shouldn't therapy just be part of it?
Yeah, it should. And I mean, I will say, some providers will share that, but I don't think, when a patient's going through cancer, they're just so focused, it's like tunnel vision, but they don't understand to the degree of how important therapy is, during their journey.
I feel like it's almost like, it's another appointment that I need to do.
Yeah.
I would love to hear a couple of patient stories. If you have any off the top of your head of just ones who have been positively impacted by oncology rehab. I think in this space, whether somebody has gone through cancer, is going through cancer, or knows someone who is going through cancer, or is just trying to be preventative, like hearing stories of people making it through is just so encouraging. Do you have any that come to mind?
I have I've worked with hundreds of people over the years, and I mean, everyone has like a different impact on my life, but I just remember this one patient. She was a breast cancer patient, and it came back twice. So this is the second round that she has gone through. And so the first round, she didn't, receive any therapies. And then the second round, she found me. And I mean, at this course, they ended up doing a bilateral mastectomy. She ended up going through radiation, and I helped her through that whole journey. So, it was beautiful to see how down and out she was. Like, the chemotherapy really brought her down, and then the radiation really brought her down. But by having that consistent therapy, we were able to, she today is just living life. Like, she has full motion, no pain. And it's just beautiful and she thanks me every time I see her, like, Lindsay, I wouldn't have been where I am today if I didn't see you. So it's just those little stories that, like keep propelling me forward and just wanting to get the word out there that there is hope for you.
Oh, amazing.
And obviously you're living in this space. I'm sure that you carry a lot of these feelings and emotions from your patients, on your own shoulders. What tips do you have for prevention in the first place?
Just preventing cancer in general.
Yeah.
It just starts at the foundation, we've all heard we got to exercise. We all heard we need to eat right. We all need to get the adequate sleep. So you have to have those pillars of health. And, if you're concerned with, where you are, I do a lot of like preventative health as well. So, if you have some breast issues, like, for example, if you have cysts in your breast or you have pain in your breast, I do preventative stuff too, where I can do a full out assessment and I can help coach you on what kind of steps you need to take to better your health, better your breast tissue. And, also my background, our Motherhood Alliance, we have so many beautiful professionals in our system that, I can refer out. So if there's certain areas you need help with that I have no idea, I can reference you to who you need to go.
Yeah, absolutely.
I think the final question for this episode is just, what advice do you have for someone who is maybe newly diagnosed with cancer because they are in a state of just overwhelmment, thinking about all the appointments that are coming up, and honestly adding on oncology rehab as more appointments, even though we know the benefit of it. All of it, I'm sure, is just so overwhelming. So what would be your hottest tip of advice?
I know you have to slow down. You have to take a breath. I know with these patients, it's just like you get that diagnosis and it's like, oh my gosh, you're in panic mode. It's like, take a breath, think, And in regards to the therapy, earlier is better because I have seen tremendous changes and you don't have to live with those long-term side effects. So if you can get in early, whether it's just establishing with, someone like myself so that we can get a baseline, we know a path we need to go. And you might not have to see me regularly, but having that first initial assessment is absolutely key in my opinion.
If somebody is listening to this and they just want to contact you, whether it's to ask about your services, inquire, ask more questions about this topic, what would be the best way to contact you? And do you have any sort of initial consults? Tell us about that.
The best way to get a hold of me is on my website, so upliftedoncologyrehab.com. And so I have a contact tab. You can, fill out your questions. I will reach out to you. There's my phone number available on there as well. So, I've just done phone consultations where I've just talked on the phone with individuals. I've had patients, just come in and sit down and talk with me as well. So I am so happy to, do whatever we need to do to get you on the right step.
Awesome. And I know something exciting for you is that you've linked arms with some of the other Motherhood Alliance professionals in our area, and now you've started a podcast. Why don't you tell us a little bit about your podcast?
Yes, we are the Integrative Edge. And so we are a holistic team. We talk all about just different fun topics, all about holistic health. We go off the cuff sometimes and pretty crazy topics. So our goal is just to really educate, our community all about the different holistic options and different things that maybe you don't think about.
Awesome. Well, now they have their top 2 podcasts that they're going to be having on their queue, right? So awesome. Well, thank you for sharing so much about your baseline of what you do and how you're serving our community in this episode. But in our next 3 episodes, we're going to be diving into depth into some specific topics. And speaking of cancer prevention, in episode 2, we're going to be talking about the hidden impact of ill-fitting bras on breast health. And we're going to be talking a lot about breast health, I'm sure breast cancer prevention in that one. And then in episode 3, more about that lymphatic system that we talked about in the beginning of this episode. So that is something, if you've never heard of lymphatic system, or maybe you've heard of it and you're just kind of I'm not super sciencey person, I'm going to highly encourage you to listen to that episode because your lymphatic system is so important. And then in our 4th episode, we're going to be talking about a little bit of your gut. We're going to be diving into the TMI topic of poop. It's not going to be TMI with us because it's important to know that you have a healthy digestive system. So we have some bomb episodes coming up with Lindsay. Make sure you stay tuned for those. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.